you have depression? How is your memory? Why are these questions coupled together? Because the brain really only has one defense mechanism, microglial activation. So it turns out that things like depression, ADHD, memory loss, dementia, they're all sort of on a continuum of brain inflammatory degradation. So let's look at this from the New York Times very recently, January 23, 2020. Depression may elevate dementia risk. A Swedish study found that men and women with depression were much more likely to develop dementia than their peers without depression. This is not the first study of this sort. There are many studies that come to the same conclusion. Now let's look at depression. The brain on fire in Psychology Today. Depression and inflammation. Studies show that there is a link between inflammation and depression. So by inference, there's a link between inflammation, depression, and memory loss, and dementia risk. So they're all connected. We need to take care of our brain. Our brain has 10 times the blood flow of average tissue. So in many ways, what's going on in the brain is very much affected by what's going on in our blood. Inflammation, poor nutrient density, the foods we're eating, the sedentary behaviors, all these things are either will help reduce depression, reverse it, prevent it, and the same is true as long as you haven't progressed too far with dementia risk. Thank you very much.